My Health, Our Future is based on a report delivered by Norman Lamb in March 2015 called Future in Minds. Subsequently, from Future in Minds, Suffolk was awarded £1.2 million in October 2015, which rises to £2.3 million in 2020. Of that, £127,000 per year is ring-fenced for educational needs. Healthwatch Suffolk saw an opportunity to provide service user experience and the voices of children and young people to develop and enhance the Emotional Wellbeing Plan 2020. At the start of the Emotional Wellbeing Plan 2020 in October 2015, Healthwatch Suffolk saw a chance to engage with children and young people on aspects of mental health and wellbeing. To do this, we went to the Thomas Gainsborough School in Sudbury and ran a pilot over the course of 1 month. During this pilot, we spoke to 600 pupils and informed the start of the Emotional Wellbeing Plan 2020. Due to the success of the pilot, the clinical commissioning groups funded us to go across 8 schools in the academic year of 2016-2017. We adapted our methodology and we used an informative, interactive online survey that could be placed into the classroom as a lesson plan. The My Health, Our Future programme used the Short Warwick Edinburgh Mental Health Wellbeing Scale. We evaluated the wellbeing across the population and we received 5,397 responses to this question. The average wellbeing out of 35 was 22.6. This is slightly lower than the health average norms for England, which is 23.6. When we look at the distribution, we see that they have the same overall bell curve. Now this means that across our children and young people, it is representative of the wider picture across England and Wales. One of the fundamental reasons that we have a slightly lower than average mental health and wellbeing scale in Suffolk is because of female respondents. So we see that male respondents stay within a trend and are within the average compared to national data. Females, however, once they get to the age of 15, drop into the lowest 25% of the population when compared to national data. My Health, Our Future asks questions around children's mental health and wellbeing and whether it was taught in schools. 45% of respondents said that they were not taught about mental health and wellbeing in the curriculum. The data we have shows that as students get older, particularly over 14 years of age, they are not taught about mental health and wellbeing. My Health, Our Future also asked students about what causes them stress. So we see from the age of 11 to 16, aggregated responses around school and work-life balance cause children undue stress. My Health, Our Future tried to ascertain the prevalence of self-harm across the students we surveyed. We found that 15% had previously self-harmed. What was more shocking is that 40% of students didn't know where to turn if they needed help around mental health and wellbeing and specifically self-harming. We also asked questions around cyberbullying, specifically, have you been cyberbullied in the last 2 months? 8% of students, almost 1 in 10, said that they had been a victim of cyberbullying in the last 2 months. This is similar to Ofcom's findings in 2015, which states the national average of 8%. One of the most shocking findings, personally for me, is the lack of sleep our children and young people are getting across Suffolk. At age 11, 1 in 10 are getting less than 6 hours sleep per night, a daily deficit of 2 hours. By the time they reach 16, 6 in 10, 60% of children and young people are getting less than 6 hours sleep per night. Over the week, this is an aggregated deficit of 10 hours per week, which leads to lack of concentration, a rise in stress, and as we can see in our report, lower levels of emotional well-being. My Health, Our Future sought to understand how children and young people conceptualise and perceive their own body image and body dysmorphia. So we asked the question, how often do you worry about your appearance or body image? We found specifically across the female population, there is an incremental rise in worrying perceptions of body image. At age 11, 41% of female respondents worry about their body image most or all of the time. By the age of 16, this rises to 76%. So this means over 3/4 of all females aged 16 worry about their body image most or all of the time. Healthwatch Suffolk successfully sought the views of over 6,800 children and young people. This is the first time Suffolk has ever had a statistically representative sample of children and young people to inform service delivery across the system. The My Health Our Future project in year 1 made 7 recommendations. Broadly, these related to a whole school approach to mental health and wellbeing and a system-wide approach to mental health and wellbeing, including the clinical commissioning groups, Suffolk County Council and schools themselves via groups such as the Schools Coordination Group and the Head Teacher Forum. Specifically, one of the recommendations was around workforce development in Suffolk. So in 2016-2017, Suffolk County Council and the CCGs delivered workforce development in relation to mental health and wellbeing across the system. We found this to be quite sporadic and not targeted. Therefore, Suffolk County Council and the CCGs have agreed to start a task and finish group to recommission the service in 2018 in line with the findings in My Health Our Future. Going forward, relationship and sexual education will become mandatory in all schools in 2019. Therefore, we would like to use My Health Our Future in year 2 to implement questions to make sure this is co-produced for the children and to make sure that the curriculum works for all. There is also currently a Children and Young People's Suicide Prevention Strategy Task and Finish group in Suffolk. Again, in year 2 of My Health Our Future, Healthwatch are offering the Task and Finish group several questions so the strategy and initiatives can be co-produced with children and young people. Over the last several years, Public Health Suffolk's Joint Strategic Needs Assessments have looked at several children and young people initiatives. However, they haven't always sought the views of current children and young people and have always looked at retrospective data sets. Going forward, we would like to work in partnership with Public Health to deliver and co-produce up-to-date joint strategic needs assessments that work for students and children and young people that are currently living through experiences such as drug misuse or cyberbullying. Healthwatch Suffolk hope for longevity and sustainability through My Health Our Future. Historically, commissioners and service providers have looked at retrospective data sets that are not timely or proficient at giving and delivering a picture of children and young people across the county. My Health Our Future affords us as service providers and signposting services to deliver timely initiatives that work for our children and young people and that are co-produced by our children and young people. My Health Our Future has also received national recognition. Recently, we received a letter from the Parliamentary Under-Secretary of State for Care and Mental Health, Jackie Prince-Doyle MP. Our findings and our report is going to be put forward for the Green Paper that is currently being consulted on until March 2018.